So this is rather going to be a very small video, but a very high yield one. So I was going through my book and I was studying, and I got to know about a very kind of interesting thing that a lot of females suffer from it, and might help you in getting to know about the actual pathology or the mechanism of action, how this disease arises. So we are going to talk about how actually uh, polycystic ovarian syndrome manifests. So basically what happens in polycystic ovarian syndrome is that there are high uh, gonadotrophin release, or the gonadotrophin releasing hormone has high pulsatility, which causes increased release. High pulsatility causes increased release of luteinizing hormone as compared to the FSH. So LH is released preferentially more. So that's one thing. Second thing is that it mostly occurs in females who are having some kind of metabolic disease, like she's having obesity or she's having diabetes mellitus. I'll tell you the exact reason why. So what happens, from your brain there's increased LH production, and from your pancreas there's increased insulin secretion. These two work synergistically, and they act on our theca cells. We know that the ovum that is going to release has the oocyte in the mid, then it is surrounded by granulosa cell, and then it has theca cells. I'm talking about that very theca cell that gets stimulated by luteinizing hormone as well as insulin. So when it gets activated, it releases increased estrogen. So what happens next is that very actually they release androgen, and that very androgen, what happens next is that androgen goes to your fat cells, and our fat cells, or uh, our fat cells as well as our ovaries have aromatase enzyme that causes that uh, androgen to convert into a form of estrogen. So that very estrogen, what it does, that's very funny, that it goes again up to your pituitary, and it blocks the negative feedback mechanism, causing decreased release of FSH. So in a patient of polycystic ovarian syndrome, what you are going to see is, you are going to see decreased FSH, you are going to see increased LH, you are going to see increased insulin, you are going to see an obese patient that has menstrual irregularities, you are going to see him fat, obese, and having signs of diabetes. Thank